Today we will talk about insulin for hyperkalemia management and liver transplantation. Severe hyperkalemia is a serious problem during liver transplantation. It is very short-lived, but severe hyperkalemia on graft reperfusion can cause cardioplegia. There are several causes for hyperkalemia. One of them is transfusion, since the blood products contain significant amount of potassium, renal insufficiency, and the sudden release of potassium from the graft upon reperfusion. In this presentation, we will talk one of the landmark studies where insulin was used to decrease the potassium level in liver transplantation. This was a randomized controlled trial including 40 patients. In the control group that included 20 patients, no treatment was performed. In the treatment group that also included 20 patients, IV bolus of regular insulin 20 units was given 10 minutes into the anhepatic stage. This was followed by a glucose infusion 500 milliliters of 5% dextrose over 15 minutes to avoid hypoglycemia. Looking into the demographic data of the two groups, there was no difference in the control and the treatment group. They also looked at BUN, creatinine, urine output, and urine potassium level to make sure this is not a confounding factor. They also looked at transfusion requirement, which was about 6 units in each group, and the potassium concentration of the blood mixture that was used. And there was no difference between the control and the treatment group. This graph summarizes the findings of the study. The red line is the treatment group, and we can see insulin was given 10 minutes after the anhepatic stage, and the potassium level drops all the way down to 60 minutes into the anhepatic phase. We see a rise of the potassium level on reperfusion, and it normalizes 5 minutes afterwards and evens out at 30 minutes. When we look at the black line with the squares, that's the control group. And we can see there's no significant change in the rise of the potassium level up to 60 minutes into the anhepatic stage. Then we see a rise the same as in the treatment group, that's the reperfusion phase, and it also normalizes 5 minutes after reperfusion and evens out at 30 minutes. So in this slide, we want to look at the change of potassium over time. 20 units of insulin, when we look at the right table, would decrease potassium level to 4.18 at 15 minutes, 3.97 at 30 minutes, 3.57 at 60 minutes, and then a spike on reperfusion at 5.9. In the control group, it's fairly even at 4.4, and there's a spike on reperfusion at 7.6. So when we take the delta value, potassium decreases by 0.5 in 15 minutes, by 0.7 in 30 minutes, and about 1.1 in 60 minutes. And in both groups, the potassium level went up on reperfusion by 2 to 2.4 millimole. So in conclusion, insulin effectively decreases potassium level within 15 minutes and for at least 60 minutes. There was no analysis done beyond the time because reperfusion occurred after 60 minutes in the study. However, there is a high possibility that potassium level would further decrease. The potassium concentration increased similarly in the control and the treatment group on reperfusion by about 2 to 2.5. And the potassium concentration returned to pre-reperfusion levels within 5 minutes after graft reperfusion.